How does the ATP7B gene cause Wilson's disease? Imagine your body as a well-organized factory, with each part doing its job smoothly. One of these jobs is managing copper, a mineral your body needs in small amounts. Copper helps with energy production and other vital processes. But too much copper can be harmful, especially to your liver and brain. That's where the ATP7B gene comes into play. It acts like a supervisor, making sure copper is transported and eliminated properly. The ATP7B gene provides instructions for making a protein called copper-transporting ATPase2. This protein is like a tiny conveyor belt that moves copper into specific parts of liver cells. Inside the liver, copper is used to make ceruloplasmin, a protein that carries copper in your blood. The ATP7B protein also helps send excess copper into bile, which is then expelled from your body through your digestive system. This process keeps copper levels balanced and prevents buildup. When there are mutations or changes in the ATP7B gene, the instructions for making the copper-transporting ATPase to protein are disrupted. These mutations can cause the protein to become dysfunctional or unstable. As a result, the protein cannot transport copper effectively. This means copper starts to accumulate inside liver cells because it is not being properly excreted into bile. The excess copper causes oxidative stress, which damages the cells by producing harmful free radicals. Over time, this damage can lead to liver inflammation, scarring, and even cirrhosis, which is severe liver scarring that impairs liver function. The copper buildup doesn't stop in the liver. It can spread to other parts of the body, including the brain, where it can cause neurological symptoms like tremors, difficulty speaking, or movement problems. Copper can also deposit in the eyes, leading to characteristic rings called Kaiser-Fleischer rings. The severity of symptoms can vary depending on the specific mutation and other factors like environment and overall health. There are more than 250 known mutations in the ATP7B gene, with some being more common than others. For example, the H1069Q mutation affects a part of the protein responsible for binding ATP, which provides the energy needed for copper transport. When this process is impaired, copper cannot be moved efficiently, leading to accumulation. Interestingly, even people with the same mutation can experience different symptoms, highlighting how genetics and environment influence the disease. From a liver health perspective, the failure to properly excrete copper results in ongoing liver damage. This damage can progress from fatty liver and inflammation to more serious conditions like hepatitis, cirrhosis, and even liver failure. If untreated, Wilson's disease can lead to increased risk of liver cancer due to the continuous cycle of injury and regeneration caused by copper toxicity. In summary, mutations in the ATP7B gene cause Wilson's disease by disrupting the normal process of copper transport and excretion. This leads to copper accumulation in the liver and other organs, causing damage and symptoms over time. Early diagnosis and appropriate treatment are crucial to managing the disease and preventing irreversible liver damage. If you suspect you have Wilson's disease or have a family history, it's important to consult a healthcare professional for proper testing and guidance.